Mr. President, my colleagues have spoken tonight eloquently about a number of consequences that would follow from the repeal of the Affordable Care Act. Increasing of drug costs for seniors, devastating impact on rural hospitals, elimination of consumer protection in everybody's health insurance, not just those on the Affordable Care Act, limitations on mental health coverage, substance abuse. All of those issues have been presented eloquently and passionately. I want to do something a little different. And this isn't easy for me, but I want to tell my own story and why I feel so strongly about the issue of health insurance for all of our people. 43 years ago, I think it was just about this week, I was a young staff member here in the United States Senate, a junior staff member who was covered by health insurance provided by my employer, the United States Senate. I paid a share, the Senate paid a share. But the health insurance that I had as part of it free preventive care, exactly like that is required by the Affordable Care Act. The other thing that the plan that I chose had was a Wednesday night doctor's session. So because I had a free checkup, and because it was on Wednesday night and I didn't have to miss any work, in late January, early February of 1974, I went in for a checkup. First one I'd had in 8 or 9 years. Everything looked fine, and as I was putting my shirt back on, the doctor said, "Well, you've got a mole on your back, Angus, and I think you ought to keep an eye on it." That night I went home and mentioned it to my wife. The next morning she said, "I don't like the looks of that thing. Let's have it taken off." I went back in the following Wednesday night because they had Wednesday night hours. I didn't have to take off from work. I had coverage, so I didn't have to worry about what it was going to cost me, and the mole was removed. When they called me to come back in, I will never forget this moment as long as I live. The doctor said, "Angus, I think you better sit down." And he told me that I had what was called malignant melanoma. At the time, I didn't know what it meant. I thought it was simply a skin cancer. You hear about those all the time. You have them taken off, and there's no big deal. No. Malignant melanoma is one of the most virulent forms of cancer. And one of its characteristics is it starts with a mole, but then once you don't treat it, it then gets into your system and goes somewhere else. And if you don't catch it in time, you'll die. I caught it in time. I had surgery, took out a big hunk of my back and surgery up under my arm. To this day, my shoulder is still numb from that surgery, but here I am. It has haunted me since that day that I was treated and my life saved because I had health insurance. I know to a certainty that had I not had that coverage, had I not had that free checkup, I would not be here today. And it has always stayed with me that somewhere in America, that week, that month, that year, there was a young man or a young woman who had a mole on their arm or their back or their neck, couldn't do anything about it, didn't really think about it, didn't do anything about it until it was too late, and they're gone, and I'm here. I don't know why I was saved. Maybe I was saved in order to be here tonight. But for the life of me, I cannot figure out why anyone would want to take health insurance away from millions of people. It is a death sentence for some significant percentage of those people. In 2009, the American Journal of Public Health did a study, a comprehensive study. And what they concluded was that for every million people who are uninsured, you can predict about 1,000 premature, unnecessary deaths. So the math is pretty simple. Right now, we're talking about over 20 million people that have been afforded health insurance either through the exchanges or through the expansion of Medicaid that didn't have it before. And if we take that away, that's 22,000 deaths a year. How can we do that with good conscience? How can we sentence people to death? We're talking about bankruptcies and talking about all the kinds of stories that we've heard. They're all valid. They're all important. But for me, this is personal. This is about life itself. It's about our ethics, our morality, our obligation to our fellow citizens. And like all the other speakers, I know that there are lots of problems with the Affordable Care Act. I wasn't here when it passed. It isn't exactly the way I would have worked on it or written it. I'm ready to sit down with anybody that wants to talk about finding a solution. But let's not talk about the solution being ripping coverage away from people who desperately need it. It's just wrong. And I understand the political impulse. The folks on the other side of the aisle have been talking about this for 6 years, and by golly, they're going to repeal it and get rid of it, and people cheer and all of that kind of thing. But now it's real. This isn't rhetoric anymore. This isn't a bumper sticker anymore. This isn't a rally anymore. This is real people's lives. So let's just slow down. And if people want to come up with a different solution, if they want to modify the current system, if they want to try to make changes that make it easier for small businesses and change the hours of work that require, that's the definition of full-time, all of those things can be discussed. And I don't care who leads it. I don't care whether we call it Trump care, McConnell care, Ryan care. We can call it whatever we want. But the fundamental principle here is that health insurance is a life or death matter. And we should honor the commitment that has been made to those millions of people, including over 80,000 people in Maine, who have taken advantage of this program, many of whom have never had health care before. Many of whom have had tragic stories, which we've heard all night, about children born with birth defects or children that had some disease at a young age, or an adult who finds, as we just heard a few minutes ago, that finds that they had cancer. If they hadn't had the coverage and gone in, they wouldn't be here. This isn't politics. This is people's lives. And I can't believe that the good people that I know in this body on both sides of the aisle can't figure out a way to say, let's slow down and talk about how to fix it, how to change it, how to replace it, but put that before repeal. Because once repeal occurs, all kinds of bad results, and even if they're grandfathered and people say, well, we're going to repeal and delay, that's repeal and chaos. The insurance industry is going to start to pull back. The health care industry is going to say, well, we don't know what the situation is going to be. We're going to have to slow down. We're going to stop hiring. We're going to have to lay people off. All those changes are going to start happening right away. They can't be prevented. And to tell people that, don't worry, we're going to cover you, that's cruel. And I don't think my colleagues intend to be cruel. There's not a mean-spirited person in this body. We just have a different view of how to achieve these results, but the fundamental result should be people have health insurance so they don't have to risk their lives every day and live under that threat. That's what this discussion is all about. That's why I'm here. I view this as much more than a political issue. And I understand the differences, and I understand the history, and I understand the politics of it, but I just think now that it's real, let's slow down and find another way to solve this problem that protects the gains that have been made and sands off the rough edges of the law, but allows us to protect the fundamental idea of helping people to find health insurance that they can afford and to keep them from being denied health insurance for reasons through no fault of their own. I think this is a moral and ethical issue. And I go back and I feel so strongly about this because of my own experience. I feel I owe it to that young man in 1974 who didn't have insurance, who didn't have the checkup, who had melanoma, and who died. I have an obligation to that young man to see that that doesn't continue to happen in the wealthiest, most developed society on earth. This is something we have it within our power to do. And I deeply hope that we can take a deep breath, back away from this idea of we've got to repeal, and talk about fundamental principles of helping people to cope with this most serious and personal of issues. Mr. President, I have confidence in this body. I have confidence in the goodwill of this body and of the American people. And if we can get away from talking about it in the abstract as a political issue, we can talk about it about real people. And that's what I hope we can do over the next weeks and months, and I'm convinced we can come to a solution. Not that'll make everybody happy, but will save lives and make our country a better place. Thank you, Mr. President. I yield the floor.